Welcome back at 9:14. From working at home to worries about COVID, the past year has been particularly stressful. As a result, physical therapists have seen an increase in patients with problems resulting from those stresses and life changes. Paul Gallant joins us from Touro's outpatient physical therapy department to discuss this side effect of a rough year. Good morning. How are you?
Morning. I'm doing great. How are you?
Good. Thanks for joining us. So what kind of complaints are people showing up with these days?
Well, we're seeing a lot more neck pain, a lot more jaw pain, a lot more upper extremity dysfunction as related to neck and shoulder issues. And a lot of the stuff is stemming from stress, increased stress, a lot more screen time. Just the stress level seems to be kind of cranked up the past year.
And so some people may be coming in saying, hey, this hurts, this is going on. They may not even recognize that it's because of these stressors that are creating these problems.
Sure, yeah. No, oftentimes the first step for us is just trying to figure out what's going on, what's causing that. Some people, they're sitting at their desk and all day long they're turning their head to the right, talking to coworkers or looking down at documents. And so our job is to figure out what's causing that increased tension and then trying to help them develop strategies to reduce that tension.
Well, I think it's clear and probably safe to say that for most all of us, COVID has been a pain in the neck, right? So what can we do to try and alleviate some of those stressors?
Well, just from a mental health piece, taking time every day to do some breathing exercises, do some stress management. Exercise is huge. Getting into a regular exercise routine is hugely helpful. And just being mindful of your posture, being mindful of what's stressing you out, trying to think about those things and try to keep that at the front of your mind as you're going through your day.
Now, one of the things that I know we had talked about briefly in the break was folks that are maybe grinding their teeth, clenching their jaw. That's something that people may not even realize they're doing because of all this stress buildup. Are there exercises that you can do, things you can watch out for to try and stop that?
For sure. Yeah, no, one simple thing that you can do is make sure to always maintain a small amount of space between your teeth. Oftentimes people are, like you said, clenching throughout the day, and they think it's normal to hold their teeth together, when really it's a much better situation for all the jaw muscles to allow a little bit of space between your teeth, and that sole factor can be hugely important just to alleviate the tension in the jaw. Of course, there are other things like trying to limit your chewing gum and different things like that, watching the food you eat, all that sort of stuff. But just from a day-to-day mindfulness perspective, just keeping a little space between your teeth, and of course there are exercises, and you probably have to get your PT or your doctor to kind of teach you those exercises. But there are definitely things that you can do to alleviate that tension.
So a lot of folks, we all know that there's so many folks that are working at home and probably still working at home. I know when I'm here in the office, it's easy to kind of get up and maybe walk around a little bit, go talk to someone, whatever it may be. Most people, like you said, are probably just sitting down at home these days. Posture is a big one. What can we look for? What should we be doing to ensure that our posture is correct and that we're not putting more strain on our backs while we sit?
Sure. Sitting upright is kind of a good, just generalized idea, but there are things, you can Google ergonomic desk space or something like that, and that can kind of give you some pointers on how to set up your desk. Oftentimes I'm advising people that work from home to get a standing desk or figure out a way to stand and work if you can't take breaks from your desk. I see people who are like at a desk for 10 or 12 hours a day straight, and then they're coming in to me and having these issues, and oftentimes it's just about trying to build in breaks in your day. Once an hour, take a 10-minute break if you can. If you can't, get a standing desk that you can stand and work at. Just taking little breaks. I think it's easy when you're at the office. You go get coffee, you go get water, you're walking around, you go to the bathroom. At home, it's easier to sit for hours. And I think that's what's getting people in trouble. So taking breaks is hugely important.
All right, so a lot that we can recognize now, things that are going to help us out. Thank you so much for joining us this morning. We certainly appreciate it.
Thanks for having me.
Absolutely.